best interest in your heart.
Okay, right. So this is how to say it perfectly correct. I can see that we have a difference in opinion. However, I would like to assure you that I do have your best interest at heart. That is why I think it will be unnecessary for me to prescribe to you diazepams today. Something like that, right? Now, I think we studied this in the past, right? How do you decline your patient's request tactfully? And that is one skill that the OET wants to test you on. It's a very good clinical communication skill to be able to say no to your patient, right? So the first thing you want to do is to sympathize with your patient. So in this case, you can tell your patient, Mr. Smith, it is understandable to think that you would benefit from lorazepams, something like that, right? However, I would not be able to issue this prescription today, right? You need to go straight to the point. So first, you sympathize with the patient, you say a big no to the patient, and then after you can offer some alternatives, right? So to improve your sleep, I think it would be better for you to reduce your caffeine intake, spend some time outside breathing some fresh air, and observe, let's say, good bedtime hygiene. That will help improve your sleep, something like that. Okay, great. So sympathize with the patient, say no to the patient, and offer alternatives. Okay, right. And also, what you can do is if you want to take away that responsibility from you, that I'm not saying no, you can say, according to the guidelines from the NHS or the Ministry of Health or the American Cardiology Association, what have you, I will not be able to issue you this medical certificate, or I would not be able to write you this prescription you're requesting today, something like that. So that what you're trying to do is you're taking the responsibility away from yourself, right? It's not you, but it's the guidelines. The guideline says we cannot give such medication to the patient. So that's a very good trick you could also use. Okay, all right. Do you have any other questions? Okay, good. So let's jump into a role play today.